Welcome everyone to the International Public Safety Data Institute September webinar. My name is Alex Troutman and I am the Customer Success Manager at IPSDI, and we are thrilled to have you with us today. For those who may not be familiar with IPSDI, we are a collaboration of fire service organizations built from partnerships we have developed for many years. The IPSDI is a nonprofit research and data science organization, and we host these monthly webinars to provide information to enhance what you do at the local level and give you another opportunity to get insights for decision-making at the operational level, the prevention level, or the pre-planning level, all of which depend on good data resources. I want to let you all know that we are recording this session so that we can post it in our training tab on the IPSDI website so that you can go back and reference information shared or share it with others. As a reminder, this is the second part of a two-part series. So if you missed the first part, it is available in that training tab just mentioned, which we will link in the chat for you. During this webinar, you will be able to use the chat function at the bottom of your Zoom screen to ask questions. And with that, I will hand it over to Dr. Stanley Gilbert to introduce himself and our returning guest speakers. Thank you.
Hi, I'm Stanley Gilbert. I am an economist working for the National Institute of Standards and Technology here in the Washington, D.C. area. Most of my research is related to fire, both domestic and wildland fire, although I've dabbled a little bit in disaster resilience. Our discussion today is, give me a second. Our discussion today is regarding the HomeSafe program that's been carried out in the city of Surrey in British Columbia. The program was implemented in 2008. It has reduced fire fatalities in the city by 40%, resulted in a reduction in residential structure fires by 70%. The webinar itself has actually been conducted in two parts. Part one, which occurred in August, talked about the research and goals of the program and the information that went into designing the program. Part two, which we will be looking at today, focuses on operationalization and delivery of the program. Three presenters we have today from the city of Surrey. Larry Thomas, who is chief of the City of Surrey Fire Service, has been with the fire service for 32 years. As part of his role as fire chief, he is the City of Surrey emergency planner and EOC director, and he's the response lead on the opioid crisis. Mark Griffune is deputy fire chief of community risk reduction and the deputy emergency program coordinator for the City of Surrey, and he's responsible for emergency preparedness and community engagement. He's been active with the organization as a firefighter since '94 and was promoted to management in 2016. Shelley Morris has been a member of the Surrey Fire Service for 24 years. She started as a career firefighter, but she's moved through the ranks to the position of captain and into her current role as the Assistant Chief of Community Engagement and Emergency Management. And with that, I will turn it over to them and let them go with the presentation.
Thank you, Dr. Gilbert. So we're very pleased to be participating in this webinar today. And you heard the intros from our people. I'm fortunate as Fire Chief to have a great team with Deputy Chief Griffune and Assistant Chief Morris that stay on top of the data and work with our analysts to continuously monitor our program. And so I think you'll find the operationalization of the HomeSafe program and how we conduct it fairly insightful and hopefully helpful, and may reduce some barriers to others picking up a similar program. And with that, I am going to turn it over to Assistant Chief Morris now to start the presentation. Thank you. Over to you, Shelley.
I'm not seeing any slides coming up.
Okay.
There we go. Hello, everyone. Thank you for inviting Surrey Fire to present on our HomeSafe risk reduction program using evidence-based decision-making. Last month, we presented on the studies and data gathered that allowed us to develop a program to reduce fire risks to the public and reduce exposures to firefighters. Now that the history of HomeSafe has been provided, I will now discuss how we cost-effectively operationalized HomeSafe over 13 years and the adaptations we made along the way to enhance efficiency. I will finish with a summary of what we found worked best to provide the outcomes to meet our objectives in reducing the rate of fire and increasing the rate of working smoke alarms in a city that is home to 12% of BC's population and now has over 500,000 people. To inform the development of a targeted home visitation program, Surrey Fire worked with the University of Fraser Valley, as mentioned in the first study, to evaluate factors that may affect the likelihood of fire-related casualties. As the research had shown, the risk of fire fatality is not random. Certain populations have a higher risk of dying in a residential structure fire. Our first step in setting up the HomeSafe program was to identify where in the city those non-random population characteristics were. By locating homes with the highest percentage of risk factors, we could avoid the broad brush approach, which would not have the same impact in the fire and casualty rates as we had been seeing. Using data obtained from Census Canada, we looked for dissemination areas with the highest combined risk scores, which, as mentioned, are homes with occupants under the age of 6 and over the age of 64, single parent families, residents who moved frequently, and low income or unemployed residents. Interestingly, Census Canada does provide a deprivation index, which has shown to match the risk scores we have developed and can be easily utilized to conduct a targeted HomeSafe campaign in other cities. So once we knew the dissemination areas with the highest risk scores, we overlaid it with our geographic areas which were experiencing the most fires. City data provided the addresses we needed within each dissemination area. And finally, our own internal data set allowed us to compare these areas with identified working smoke alarms, which is captured by our fire crews and recorded internally on our data management software. Using this integration of data sets, we have been able to create each temporal cohort. To ensure that all activities we developed achieved our objectives, targets were identified of which to measure our efforts against to determine effectiveness. The data we use to measure success rates are number of fires at inspected properties within the HomeSafe program, number of residential fires in the city of Surrey, number of casualties, number of working smoke alarms at residential fires, percentage of fires contained to the object or room of origin to represent fire severity levels. To determine what type of risk reduction education material to provide, we looked at our highest ignition source. In 2008, cooking fires were the most prominent source of residential structure fires. We began HomeSafe in 2008 to mitigate the growing rate of fires with a door-to-door campaign. This was initially conducted by on-duty firefighters who provided fire prevention information and offered to test and install free smoke alarms. Utilizing the integrated data set to develop target areas with non-random characteristics, firefighters were then sent to these targeted homes to have the greatest opportunity to reduce the known risks. The creation of temporal cohorts have given us the ability to assess the effectiveness of each initiative on the fire outcomes over the following years. To generate the targeted areas for each fire hall, geographic areas with a higher occurrence of fire incidents were identified to form the basis of a broad catchment. Then street addresses were identified within the catchments, of which we then looked to cluster addresses to minimize the amount of unnecessary driving. In the first 3 years, nearly 19,000 homes were visited within 7 cohorts. Each cohort was visited over a 1-week period, during which time regularly scheduled training was suspended. Firefighters were advised that the goal was to visit homes in a direct attempt to prevent and reduce the number of fires and injuries. The message was to emphasize that residential fires account for 75% of all fires in the city. Crews allocated 5 minutes per visit to educate citizens on the importance of a working smoke alarm and provide fire safety material. For those without a smoke alarm, crews would install a free one. In 2009, HomeSafe expanded to encourage residents to request fire inspections or smoke alarm installations either by phone or online. Fire inspectors would follow up with these requests to schedule an appointment convenient to the resident. A HomeSafe inspection involved a risk assessment of 30 items most often found in a residence, which can increase fire risk, such as oven safety, electrical cords, and heating units. If the request was for a smoke alarm installation only, a detailed inspection would not be performed. This way, residents could still safely make a request without fearing punitive ramifications. In Surrey, suites need to be registered with the city, which can result in a higher utility cost. Knowing that renters are in a high-risk category, we needed to be able to target these homes without the resident sustaining these negative repercussions. When designing HomeSafe activities, it is important to maintain the perception that it is an altruistic program without negative consequences to the public. Between 2009 and 2010, fire crews began to conduct smoke alarm testing and validations at residential properties when responding to low acuity medical or non-emergency incidents. When crews gained access into homes necessitating a low level of intervention in a non-life-threatening situation, they were socialized to look for the presence of a smoke alarm and begin a dialogue with the resident. If the smoke alarm was present and it was considered appropriate, the fire crews would test the alarm for the resident. Should the alarm be non-functional or not present, the crews would offer to install one, of which are supplied to all trucks. Over 20,000 medical calls are responded to a year, giving many opportunities for crews to check smoke alarm functionality. As of 2018, the Surrey Fire Service replaced smoke alarms with combination smoke carbon monoxide alarms. Both Kidde Canada and First Alert Alarms provide a pricing list to all BC fire departments for purchasing through the Fire Chiefs Association of BC. These lithium battery operated alarms do not meet the BC Fire Code, which requires smoke alarms to be permanently wired to the home's electrical system and interconnected. To release the Surrey Fire Service from liability, a waiver is signed by the resident prior to installation. The decision to provide battery-operated alarms stemmed from the recognition that many barriers exist for residents, preventing them from accessing and installing a working smoke alarm. New immigrants may not be aware of the fire code and life safety requirements in BC. Renters may fear eviction should they bring it to their landlord's attention. Age and disabilities may provide challenges when testing an existing alarm, and if financially disadvantaged, the resident may not prioritize the purchase of a smoke alarm. A free smoke alarm would overcome barriers that often exist in the same high-risk demographic experiencing these fires. Each visit, verification, and install is captured in a records management system. Once a crew returns to quarters from a response call, they fill out the required online form indicating whether a smoke alarm was present, if it was verified through testing, or an installation was performed. As we discovered from 20 years of fire data, the presence of a smoke alarm alone is not enough to ensure its working condition. With the information using the verification data, we can then evaluate our fire rates with the locations of known working smoke alarms. During the second phase of HomeSafe, 7 more cohorts were developed between 2011 and 2015, targeting over 21,000 high-risk residences with door-to-door visits by firefighters. Building on the previous HomeSafe campaign, efforts continued to focus on ways of reducing residential structure fires through education and smoke alarm installs. In 2015, Surrey Fire Services created a plan of action with 3 corresponding treatments launched simultaneously. Surrey firefighters visited over 500 residential properties that previously had a fire to provide them with specific fire prevention information and offer to test or install a free smoke alarm. A partnership was developed with Surrey crime prevention volunteers who visited over 4,600 properties that were experiencing significant increases in the fire rates. Over 8,700 properties were identified as ideal locations to place door hangers, providing information for residents to install, test, and replace smoke alarms older than 10 years of age. It also included contact details to book a free smoke alarm installation. In this phase of HomeSafe, tax lineups and food banks were identified as an opportunity to interact with those populations deemed at risk. In 2015, firefighters were sent to these sites to interact with the public and provide education on the importance of a working smoke alarm. At tax lineups, firefighters instigated conversations with those waiting in the lineups. At food banks, we found people impatient to move quickly through the lineup to access food, So we offered a draw for groceries for those who stopped to talk about smoke alarms and provide their addresses for HomeSafe tracking purposes. During this phase, smoke alarm signage was displayed on the back of many of our frontline trucks with a number to call for HomeSafe requests. We hoped that the public would notice these signs when the trucks were stopped and would take down the information for follow-up. Over the 3 years that these signs have been displayed, very few requests have been received on the phone line provided. It is possible that they notice the signs and take action without fire service intervention. In 2016, 8 years after socializing HomeSafe to the firefighters, an achievable metric was introduced. A threshold of 4,800 smoke alarm verifications has been set each year as one of the key performance indicators for the fire department. Over the period of 2011 to 2017, there were 21,501 smoke alarm verifications at 15,800 residential properties during calls for service, resulting in over 1,674 smoke alarm verifications. Over 64% of those verifications occurred in the years of 2016 and 2017 after the metric was introduced. Also during this phase, oversight on HomeSafe was limited during a shuffle in management responsibilities. A decline in working smoke alarms was observed over the next 2 years. This highlights the importance of the continual deployment of HomeSafe initiatives. With the knowledge that our program was continuing to lower fire rates, decrease the death and injury rates, and contain more fires to the area of origin, lessening exposures to firefighters, we decided to look for a more sustainable HomeSafe delivery method, which would decrease the involvement of our firefighters. In the third phase of HomeSafe, an idea was born to develop an army of community engagement volunteers, which would increase our reach into the community, provide a sustainable long-term model of HomeSafe delivery, and replace firefighters in the targeted door-to-door visits, making them more available for their core activities. Management took this idea to the union to explain the intention of onboarding volunteers for the purpose of conducting community engagement activities. As this does not interfere with the core duties and responsibilities of firefighters, the union accepted this proposal, which would lessen the impact on firefighters. In 2018, community engagement volunteers were onboarded to promote fire safety education and smoke alarm testing through telemarketing, door-to-door visits, as well as events of opportunity such as the tax lineups and food banks. Volunteers now conduct all targeted door-to-door HomeSafe activities once performed by crews. Firefighters continue to do the HomeSafe during low acuity calls and conduct follow-ups required after an online HomeSafe request. To date, volunteers have completed 7 HomeSafe cohorts consisting of over 10,000 visits and have required minimal oversight and management. The process of onboarding volunteers involves a link on our website directing the volunteer to create a profile on Better Impact, which is a volunteer management software purchased by the city. Once the profile is complete, the volunteer can view the event's calendar. At this point in the process, their qualification as an applicant only allows them to view and sign up for a phone interview on a specified date and time and are required to email the resume and references. Once the interview is complete, the volunteer must fill out a police record check and mail it to Human Resources. Once this has been received, they become accepted volunteers, which now allows them to view all available HomeSafe events. This volunteer management program can be accessed by phone or computer for convenience. Upon sign up, an automatic email is sent back explaining the details of the event, including the time and place. An experienced volunteer will sign up as a team lead, taking responsibility for all new volunteers and ensuring the event runs as intended. In this way, my only involvement is the initial interview, of which I use to fully explain and inspire the volunteer with the intention of HomeSafe. From that point on, volunteers are given autonomy. Many volunteers aspire to become career firefighters and are motivated to succeed with these expected responsibilities. Each event begins outside of our Fire Hall 1. Here we have a community service van stocked with all the resources needed to conduct this event. The key is kept in a coded lockbox at the back of the van. Once everyone has arrived, the team lead ensures that all volunteers are trained and paired up for safety. The team lead is responsible for ensuring all volunteers are present, understand what is required during the HomeSafe event, and are partnered appropriately. To coordinate the delivery of HomeSafe by the volunteers, the fire service has displayed the targeted homes on an Esri ArcGIS collectors app which can be downloaded for free on their personal phones. We do provide 2 smartphones for their use, but often we have more than 2 pairs of volunteers doing HomeSafe, and this necessitates the need to download the app onto their personal phones and upload our map, of which I provide details instructions in a resource manual located in the van. This app is a portal to the city server where all data is stored. No personal data is retained on their personal devices. Once the collector's app is opened, all homes selected for a HomeSafe visit are displayed with a blue dot. Should the home also have a secondary suite, a second red dot is displayed on the same address. Each volunteer pair proceeds to the targeted HomeSafe area in the van provided or by their personal vehicle. When the volunteers arrive at a targeted home, they are asked to start a meaningful discussion on the importance of a working smoke alarm as well as cooking safety. While one volunteer has this conversation, the other volunteer clicks on the dot in the app, which will then bring up a set of questions. This volunteer captures the responses to each question in the app, which assists us in analyzing our outcomes. We capture whether contact was made or information was left. Were there any smoke alarms present? Did the resident test it? Was a smoke alarm installed and how many were installed? Once the data has been inputted and the volunteer hits update, the dot on the map disappears, avoiding multiple visits to the same address and allowing me to see how far along they are in the current cohort. I would like to point out that the expense of a van and smartphone can be avoided by having the volunteers upload the app onto their phones and storing the HomeSafe resources in an external locked weatherproof container. With the recognition that volunteers are using their own phone data and fuel, after 10 events, we send them a $20 gas card or a Tim Hortons gift card of their choosing. Knowing that personal interaction is critical to the successful HomeSafe outcomes, the volunteers are provided with jackets, high-vis vests, caps, toques, and t-shirts, identifying them as Surrey Fire Service volunteers. This is to help reduce the suspicion residents have when their home is approached by strangers. Should the resident object to the visit, the volunteer will offer them a brochure with details on how to request a HomeSafe visit by a fire crew. To conduct the event, volunteers are provided with HomeSafe kits containing the combination smoke carbon monoxide alarms, screwdrivers, flashlights, liability waivers, ladders, shoe covers, and the brochures. In 2019, we began adding post-fire maps on the collector's app when necessary. This was done when a fire occurred in an area of HomeSafe but was not targeted in the program. 50 to 80 homes surrounding the address where the fire occurred would be targeted in a new map on the app. The current map would be temporarily unpublished to reduce any confusion. Following the first post-fire HomeSafe event, the feedback we received from the volunteers was that the residents were much more receptive to the volunteers and appreciative of the fire safety information provided. In the first post-fire HomeSafe visit, out of 60 homes, 30 smoke alarms were installed, and many of the residents had reportedly purchased one in the days after the fire. As a cautionary note, there have been landlords at times which have attempted to take advantage of the HomeSafe program and have installs done on multiple rental units to save costs. The volunteers have been instructed to offer one alarm per household and encourage the homeowner to have one installed on all floors, if not in each room. If the volunteer believes it would be difficult for any reason for the resident to access an alarm on their own, they can do multiple installs. Should a homeowner make an online phone request for smoke alarm installs in multiple homes, we will advise them that an inspector will be conducting the install following a detailed inspection of the premises as a deterrent. In 2020, we had our HomeSafe brochures also printed in Punjabi, recognizing that the South Asian community now makes up 32% of Surrey's population. During the pandemic, HomeSafe conducted by volunteers was suspended for 2 months as modifications were introduced. Testing and installations previously done inside the homes have been temporarily paused. The educational visits with appropriate safety measures have continued as they occur outside the home. This continuation with modifications have allowed us to continue to decrease the fire rates over the last year in accordance with the downward trend observed throughout the history of the HomeSafe program. So what we've learned, by using temporal cohorts, we have been able to assess the benefits of each initiative by measuring the outcomes to determine its value to the program. This evaluation has shown the importance of a commitment to providing fire safety information to a targeted demographic in the geographic area most affected by higher fire rates. This was further solidified by the brief pause and HomeSafe, which immediately saw a decrease in working smoke alarms. In our evaluation, we saw that education provided loses its effectiveness after 3 years and may need a retreatment. By utilizing volunteers, we have increased our reach into the community and lessened the impact on firefighters, creating more capacity for response, training, and other firefighter duties. The 3 most important activities that resulted in a reduction in the frequency of fires were the targeted door-to-door visits that resulted in a personal dialogue with the resident, the HomeSafe inspections and smoke alarm installations conducted by crews following a request made by the public, and the smoke alarm verifications conducted by crews during low acuity calls. What we learned did not work were the door hangers, telemarketing, and visits in which the resident did not open the door and resulted in a brochure being left in the mailbox. What is next? We will continue to locate geographic areas where residents are most at risk. We will achieve real-time monitoring of our initiatives through the gathering and storing of data and utilizing up-to-date population demographics supplied by Census Canada. We will look for social interaction opportunities to deliver HomeSafe similar to the tax lineups in the food banks. And we will continue to look for partnership opportunities to expand our reach into the city to improve our safety outcomes. Over the course of more than 13 years since the HomeSafe program was introduced in 2008, over 91,000 homes have been visited with the following outcomes: an 80% reduction in the fire rates per 100,000 population, an increase in percentage of functioning smoke alarms at residential fires from 30% to 60%. Fires contained to the room of origin have increased from 15% to over 40%, and a reduction of casualties by 40%. This is especially significant in a city which has seen an annual population growth of 12,000 people. The positive impacts are consistently shown not only in properties that were visited, but throughout the entire city. The contributing factor to HomeSafe success is the consistent, systematic, and ongoing targeted approach to outreach residents and provides fire safety education. Thank you for allowing us this time to describe the HomeSafe journey. We can now answer any questions you may have.
Okay, thank you, Chief. Well, I'm just going to turn my camera on here. Right now, we don't have any questions in the Q&A, so I really do encourage people that if you have some questions you want to pose, please pop them into the Q&A and we'll get to them. But kind of to start things off here a little bit, first of all, great program. I said it the last time and I'll say it again. Very impressive numbers that you have here in putting this all together. And what really struck me was almost on your last slide, while you know your raw numbers are going down, which is great. When you correlate that with the population increase, your per capita numbers must be really impressive on this program.
Yeah, it's consistently shown its effectiveness over the year throughout that growth, and that's one of the amazing outcomes of this program and why we continue it.
Mm-hmm. One thing I was wondering too, you're installing smoke alarms. Are you doing anything for the deaf or hard of hearing population with the special alert devices for them?
We have in our stock those devices. We have not had that request or come across that need yet, but we are prepared should it exist. It does exist. We haven't had that request yet, but we're ready to do that install.
Okay. Another question I have too is you had mentioned you're targeting homes and such, and maybe I missed it during the presentation because I was kind of behind the scenes here doing some stuff. How did you determine those homes? What criteria did you use to select where the volunteers were going? Or was it on a per request basis or a combination thereof?
The targeted homes, we looked at those high risk profiles in the demographics. So they under the age of 5, over the age of 64, low income, lone parents, renters. And we use Census Canada data right now to overlay that on our addresses. So what we do is I pick about 1,000 to 1,200 homes per cohort. And I look into the areas in the city of Surrey that we're experiencing the most fires. And we try and cluster them so it makes it easier for the volunteers to go door to door. But we do realize that those risks, there's a lot more of them. So as I get down to the last 100 homes, I'll look at the next 1,000 to 1,200 high risk demographics in those similar areas. Because we know each time those high risks still exist. We are missing some of those homes, but we hope to capture them in the following cohorts. And as I mentioned previously, after 3 years, we reintroduce those addresses because we have noticed that after 3 years, it does lose its effectiveness. So we actually reintroduce those addresses after 3 years.
And what does it take to do all this data manipulation? Do you have staff on board, or are you using it from city IT, or how are you managing all this, the data process and all this?
We do have a computer analyst that does help us. So we provide, what we're looking for, and he's able to compile the data we need, and he creates those cohorts for me on the map. So we do have some assistance and support with that.
Okay. We do have one question that popped here. For the low intensity calls, what percentage of installed smoke alarms do you find to be non-functional?
Offhand, I don't have that information on what percentage is non-functional. It is something that I can capture. They do capture whether there is a smoke alarm there, but it wasn't working, and we just do a full-on replacement of that. So at hand right now, I don't have that information, but that is something that we have captured, and I can gather that information.
Okay. Another question. Have you found there to be a lot of turnover within your volunteer group, and how often are you interviewing?
I interview, I set up a schedule twice a week. So Tuesdays and Thursdays, I onboard. If I see that there's a lot of volunteers waiting to be interviewed, I'll just up it as needed. There is a turnover because they're trying to be firefighters. What I've noticed is that it's around 6 to 8 months that they will really work hard in the program, and then they will turn over. So I want to have that ongoing opportunities for interviews, because they're replacing lost firefighters. So they are trying to be firefighters. They are using this program to sort of help them get hired. But at the same time, it is a win-win. They know they really network as a group because they're all trying to be firefighters. So it's a really good networking group. They create WhatsApp, text, sort of communication system so that they can say, I'm going out this Thursday, are you? So they create that sort of network where they're encouraging each other to come out for HomeSafe, and then they do leave the program. And they generally don't let me know. It's just that I'll see them inactive for a while. So then I'll off board so I can sort of see what my capacity is in my volunteer ranks. And then I'll see the up and comers that are now taking up all the signups and working hard. So it definitely is, there is a higher turnover.
Boy, I find that really interesting because, okay, so this is kind of your farm team for firefighters. This program, it sounds like. Do you notice a change in your recruits because they've been through this, that they're more receptive to fire prevention and community risk reduction and such because they had this exposure?
Yeah, definitely. When we start to recruit, we do see this, the similar faces that are on there, but all the firefighters through that metric that we introduce have become quite socialized to it. So they're able to dovetail right into the ranks quite easily. Chief, do you have something to add to that?
I'm just going to say, from my perspective, we have seen a cultural shift amongst the culture of our firefighters, which is not an easy thing to accomplish, where they connect a working smoke alarm program to reducing their exposure time, dealing with smaller fires. Early intervention makes it safer for them. And so that culture is bought in, and it doesn't hurt that applicants that want to be firefighters are padding their resume by understanding this program. So the ones that are successful already understand the benefits of the program and have contributed to it. So it is a little bit of a self-feeding system, as you pointed out.
And obviously the focus of this is a lot on smoke alarms. Are you looking at other risk factors when you're in the homes? Trips, falls, hoarding, all that sort of stuff. Are the crews taking notice of that?
Shelley?
The crews are definitely socialized to look for those things. Yes. The volunteers, that would be more information I think that they're capable of, and they're not in the homes right now. But yes, the fire crews do look for those other opportunities to reduce risks.
It's a pretty impressive program. Has it served as a role model for other fire services in Canada or elsewhere? Are others coming to you and saying, wow, this is great, how can we do it?
We did present to the Ontario Fire Marshals Association this last spring, and we had really good attendance there. We had over 280 representatives participate in that meeting. And locally within BC, we do have a program that's built on the same premises as ours that the BC Fire Chiefs Association promotes with all its member fire departments. And so it really takes that initiative from the leadership to keep your foot on the gas pedal. Right. and engage your people so they understand why it's important. So it is a bit of a process, and like we've been at this now for 13 years, and our performance measures were another big cultural initiative that helped with this change. So the staff know that they get credit and performance evaluation by getting updates on how they're doing and a whole array of 12 different measurables with their normal duties. And it just becomes part of the culture to, do what's right and get the job done. So it's not something you just drop into a department and they start doing it right away and see the results or learn the benefits. It's an evolution that needs some time. And I think the key, to be honest, is you need to have the value in collecting good data. And then, all the anecdotal coffee table opinions will go away because you can provide them the data, the evidence, the difference it makes in the number of fires. Containing fires to object or room of origin is a big deal for cancer prevention and time in smoke envelope and things like that. The firefighters will understand. So it is a progressive program that has a bunch of components with the culture connected to it. But if you have the right people and the right initiatives, you can get there, and it does make a difference.
And it sounds like after all these years, it's something that's really integrated into your operations, if I'm right, Chief.
Absolutely, yeah. And that's what you need to keep it sustainable.
Right.
If you had to start from scratch every year, I don't know if we'd be successful. So it is integrated as an ongoing program that everyone knows and has their role to play.
Right. Switching gears for a second, Chief Morris, the app, and as a nerd, I found that really interesting. Was that something that you created? Or was it an existing? How did that come about?
The collectors app had been around. It was utilized in other areas of the city, and it did come to the attention of Deputy Griffioen, who thought that would be a really good opportunity. So it was just leveraging an opportunity that existed and utilizing it so we could manage this without being paper-based and having it accessible right at their fingertips. So Chief, do you have anything to add? Chief Griffioen?
No, that's accurate. Actually, I became aware of it at an emergency preparedness conference as an Esri product. There was a vendor there who was trying to introduce applications for emergency management. And at the time, I was developing a similar program that had a bit tighter focus. And as Shelley mentioned, it was an opportunity to go paperless. And we've been using it in many different applications for quite a few years now.
So is it an Esri application or is it a standalone?
It is an Esri app. We moved from their cloud-based service to hosting our own server within the city, which helps with some privacy concerns as far as data storage and privacy protection. And so it's quite refined. So we have people who are managing that service with IT at City Hall, but we also have become quite good at building the background or the questionnaires and the data sets that are required for each application of the app.
Yeah. And kind of wrapping up here, and I'd like to throw this out to all three of you. I know Chief Morris, you talked about the things that didn't work at the end there. And so often we learn so much more from what didn't work. If some chief was going to come up to any one of you, and you can all answer this, or you can just, I'll throw it to Chief Thomas since he's at the top, say, what should I avoid? What were the pitfalls? What just crashed and burned? What should I look out for if I want to start a project like this up?
Yeah, that's a great question. And I think I would respond to that by saying, we know these things are the things that work, the interaction at doors, the fire crews interacting at the low acuity medical incidents. We know those work. We've been published in a public safety journal on the outcomes of this program, peer reviewed. So I can confidently say, if you focus just on these components of the program, you will get success over time. And you don't want to discourage, I never want to discourage new ideas and different ways to approach the problem. But the key is evaluate them. Make sure you design it in a way that you can evaluate whether it's effective or not, because you don't want to waste time and resources on something that doesn't give you a return. And so you don't want to stymie the other ideas, but at the same time, if you're not evaluating them, you don't know if they're effective or not. And so I don't know if that really answers your question, but I think there's enough positives in the things that do work and research behind it that you could have a very good program just doing that without getting outside the box.
And probably being nimble enough to respond to those evaluations about what is working and what isn't working. If something's working really well, build on it. If something's not
Exactly.
working,
Yeah.
let's
Yeah,
pivot away.
refine what's working. Yeah.
Right. Okay. Well, we don't have any more questions in either the chat or the Q&A. Alex or Dr. Gilbert, I don't know if you have anything you want to ask or add before we wrap up today.
No, I don't have anything else.
All right. Well, then with that, I'll punt it back over to you, Alex.
Great. Thank you so much to our Surrey Fire team for the great presentation and spending your afternoon with us. And thank you for all the participants for also spending some time with us today. As we mentioned previously, we'll be posting today's recording to the IPSCI website in the training section, which has been linked in the chat. So please feel free to use it as a reference and share it with others. So have a great day, everyone, and we hope to see you at our next webinar. Thanks again.
Thank you.
Bye now. Take care.